All right, everybody, so welcome back. So we do have some very important information for you. The Ministry of Health, with support from the regional health authorities, is ramping up flu vaccinations through a series of mass vaccination sites across the country. So joining us to discuss this initiative and the importance of getting vaccinated, we do have in studio with us this morning the manager of the expanded program on immunization, Ms. Grace Sookchand. Ms. Sookchand, thank you very much for coming this morning. We do appreciate it. Of course, we are smack dab in the middle of the carnival season here, and I think that this is where it is most important, this flu vaccination exercise.
That is correct. Our flu season runs from October to May of every year, but our peak season is around December to March. And, you know, carnival season is approaching, and we expect a lot of visitors, a lot of influx of people coming into the Caribbean, coming into Trinidad and Tobago for carnival. So we tend to have higher number of cases around this time.
So it's customary that we
It
do
is
have...
customary, yeah.
Yeah. Roll out the program for us this morning. How is the Ministry of Health and the RHA is going to combat that or prepare for that?
Right, so the Ministry of Health procured 65,000 doses of the vaccine. To date, around 16,000 doses has been administered thus far. So in an effort to prepare, especially for this peak season, what the Ministry of Health has done is engaged the RHAs to have mass vaccination sites. The vaccines are available at all health centers throughout Trinidad and Tobago, Monday to Friday. But in addition to that, to ensure that we reach persons who may not get time off from work, they can have these vaccines at mass vaccination site during the weekends as well.
Yeah. Can you give us locations at all?
Sure. So some of the locations that we have currently, we have Long Circular Mall, Monday to Saturday from 11:30 a.m. to 4 p.m. We have at C3, Friday and Saturday between the hours of 11 a.m. to 5 p.m. Extra Food in Sandy Grande daily between the hours of 9 a.m. to 2 p.m. The former Unit Corporation building in Sandy Grande also on Saturdays between 9 a.m. and 2 p.m. And SNS Passade Supermarket in Rio Claro daily from 9 a.m. to 2 p.m. And, you know, these outreach activities will run from January 9th for 3 weeks. And in addition to that, other RHs may also have different sites, and they are also honoring persons requesting, organization requesting the vaccines. So we have a lot of business community that will request the vaccines, and the RHAs are honoring those requests as well.
These vaccines, who's it for? And when I say who's it for, at what age are we speaking about?
Right, that's a very good question. So we request the influenza, we order the influenza vaccines every year, but particularly, although it's available for anyone who wants to have the vaccines, particularly we look at core groups. We look at persons who are more at risk if they develop the virus, if they get infected with the influenza virus, to have complications. And those are children 5 years and under. You're looking at pregnant women, persons 65 years and over, and of course, persons with chronic communicable diseases, non-communicable diseases, like your diabetes, hypertension, respiratory illnesses, and of course, our healthcare workers.
I think that for some people I think that since COVID, there has been this hesitation by a number of people when they hear the word vaccine. In fact, it has become a very bad word to them, this issue of vaccine and vaccination. To those people who may be hesitant, and to those people who may, although you're saying to them this morning, well, here's what, come and get these vaccines because they are very, very important for your health and well-being and so on. But because of what they see on social media and so on, I think that some of them are really poisoned mentally by what they see and hear on social media as it relates to this vaccine. Speak a little bit about, again, the importance of the vaccine and also the safety of these vaccines, because there's another narrative that if you take a vaccine, it is going to impact you in a negative way. So speak a little bit to that, to the naysayers about these vaccines?
So vaccines are developed over a period of time.
Yeah.
And a lot of studies and a lot of research goes into these vaccines. Now, with respect to influenza vaccine, it is an inactivated virus. The vaccine itself is inactivated. So there are some people who say, when I take the vaccine, I get sick. There is a difference between influenza and common cold. There's no vaccine to protect you against common cold. The influenza vaccine wouldn't protect you 100% from getting influenza, but what it does, especially for those high-risk group, it gives your body a better chance to fight the virus. So it reduces the severity of the symptoms, it reduces hospitalization, and it can reduce death. So it's very important. Apart from that, vaccines has been proven through years to protect the population against diseases. And when you look at persons infected with certain diseases that are vaccine preventable, you realize the severity of how it impacts them. And I think it's important for the population to know that these vaccines are safe. They've been tested over a period of time. I will advise the population, do your research. And I'm not talking about going on Facebook, the social medias. I'm not talking about going on Google. Go to WHO website, go to PAHO website, go to the CDC website, see the credibility of where you're getting your information from, and know that the vaccines are there to protect you and to really help you live a more comfortable life.
Yeah. To the people who would want to come to get the vaccine, is there should they walk with their immunization card, or can they come? What do they have to come with? Just
Absolutely nothing. They just have to show up.
That's good.
We give the vaccines every season. It's a seasonal vaccination. So every year we get a new season of the vaccine. What we do, we don't write it in your immunization card, because if it's a seasonal vaccine, we'll fill your card, but we give you a little immunization sheet. So all you have to do is to come to the facility, to come to wherever you're going for the vaccines, let them know you're here for an influenza vaccine. You get the vaccine, you get a little card indicating that you have received the vaccine, and that's it. It's very simple. So you could be shopping at the mall, you can be just going into the health center for something else beside the flu shot, maybe to see the doctor for something else, and you can request a vaccine. Or you can just leave work during lunch hour and pop into at one of the sites, pop into a health center and have your vaccine. It's very quick.
Would you recommend that people get vaccinated every year?
Absolutely. And I'll tell you why. The reason for this is that the vaccines tend to be updated.
Yes.
You find that the strains of influenza circulating tend to mutate. So there's always an antigenic shift in the vaccine. And therefore what scientists do is that they look at all the strains that are circulating, and what they figure is going to be the most prominent one. That's what they use to make the vaccine. That virus is what is used to make the vaccine, so that it's more effective for every season.
Yeah, all right. We are now joined by Penny Ramlagan-Dabreo. She's the acting primary care nurse manager. Thank you very much for coming this morning. Well, we have Ms. Sookchand has been giving us a lot of details concerning this flu vaccination drive by the Ministry of Health, and also the RHA is here. What is your message this morning, Penny, to the people of Trinidad and Tobago read this vaccination drive?
Thank you very much. One of the things I want to remind of the public is that we are very fortunate to be in the receiving end of vaccinations. There are many countries who don't have the availability of vaccines that we have. And one of the things I also want to remind them, and I'll just second in Ms. Sookchand, that vaccination has been proven to work, even as we're on the topic of influenza. Influenza specifically is a safe vaccine like the others, and has been proven to work. It has reduced hospitalizations, and I want people to understand that we are very fortunate to have vaccines and to have a free access to vaccines. We don't have to pay, and it is our yeoman's duty to society, because we are protecting those who cannot take the vaccines, which would be the babies under 6 months, those who may have a history of Guillain-Barré syndrome. So we really need to look at the benefits of accessing this service that we have, and that is my message, that we need to protect one another, we need to protect our families, our communities, and I'm speaking from a public perspective too, as being also a citizen of Trinidad and Tobago, because I too get vaccinated.
I remember, I believe it was last year or maybe the year before, I can't remember when, but I know that in recent years, the Ministry of Health would have been forced to dispose of thousands and thousands of vaccines because people were just not coming to get these vaccines. So have you seen that narrative? Have you seen that thinking changing, that here's what, more and more people are coming out for these vaccines?
So you find that happens when persons that know about the influenza and they have seen how ill these people are, then you find there's more of a request. But this year we also found that a lot of persons are reaching out to us very early. Like for instance, the Geriatric Society of Trinidad and Tobago has been working with us to ensure all their members are vaccinated. So we have groups have already reached out to us, and they're seeing the importance of getting vaccine, especially coming up to carnival season. And I think now that we're moving away from the COVID, that people are now realizing the importance of vaccines. They are no longer listening to myths and misconceptions with respect to vaccines. So there is a greater demand, and we're hoping that, last year our uptake was very good, and we're hoping that this year we do the same as well.
Yeah. Let's talk a little bit about the process, because I think that during COVID, I think that the process worked very, very well, and that the health practitioners at the various facilities were attending to people very, very quickly, and there was this quick turnaround. What can people expect when they come to these facilities this time around?
So these facilities are geared only to administer the vaccines.
Yes.
And therefore, as soon as persons reach in, all they have to do is register. They just take their names and then they send them to one of the nurses, and the nurses administer the vaccine. It takes probably 5 minutes or so, maybe even less than 5 minutes to receive a vaccine.
Yeah.
So it's a smooth process.
After someone takes the vaccine, and we did speak a little bit about that, some of them may develop certain symptoms that they may be very concerned about. Is that normal?
That is normal. So persons might experience some discomfort at the injection site, slight swelling, redness. They may complain about a slight sore throat. But that's normal. That is normal because your body has received a vaccine, and what it's doing, it's ramping up, beginning to produce antibodies.
Right.
So that's your body's natural response in priming for the vaccines.
Yeah. All right. So prime up with the vaccine, not other things that you want to prime up with for the carnival here. Penny, anything else you'd like to tell us?
Well, it's just to again reinforce to the public, visit your local health centers. We have vaccinated the influenza and all of the other schedules, because we wouldn't just look at the influenza vaccine. We'll look at what is your health needs at this point in time. So visit your local health center and try to get your health check, get your vaccination, because we know vaccination works. It is free, it is available, it is your human's duty to protect those who cannot protect themselves and to protect the society of Trinidad and Tobago in extension.
Sookchand, anything else you'd like to tell us before you leave us?
I just want to endorse what Penny has said. We have the vaccines available. We're encouraging persons to take the vaccines. Again, as Penny said, you may have somebody, an elderly in your home, or a child under 6 months who can't receive the vaccine. If you protect yourself, you protect them. And on that note as well, if you notice your family member or anyone with severe respiratory illness, feeling fatigue, not high fevers, complaining of headaches, body pains, please take them to the nearest health facilities. They must seek medical care.
Have special arrangements been made for, let's say, the elderly or persons who may have physical challenges at some of these facilities?
Absolutely. And apart from that, what you find all of the regional health authorities, what they do is they visit the home for the aged, they visit all these homes.
Actually, we have home inspection going on right now.
Right.
And it's a collaborative effect with the Ministry of Health, so public health inspectors, district health visitors, our surveillance unit. So it's like a comprehensive, a multidisciplinary team. And one of the things we do offer to the homes is the vaccination for the staff and clients.
Yeah. I didn't ask. How is this flu spread?
So it's a respiratory illness.
Okay.
It's a severe respiratory illness. So cough, cold, somebody coughing, sneezing, touching an infected surface, that is how it's spread.
Yeah. Ms. Sookchand, before you leave us, could you please give us the information again? So the drive is already underway.
The drive is underway already for a lot of the other RHAs. Apart from these sites, there are other pop-up sites as well. But basically, Long Circular Mall, from Monday to Saturday between 10:30 a.m. to 4 p.m. C3, Friday to Saturday, 11 to 5 p.m. Extra Food Sangre Grande daily, 9 a.m. to 2 p.m. Former Unit Corporation building in Sangre Grande on Saturdays between the hours of 9 a.m. to 2 p.m. SNS Passage Supermarket in Rio Claro daily from 9 a.m. to 2 p.m. And as I said, these activities run from January 9th for 3 weeks.
Yeah. Ladies, thank you very much for coming this morning. Again, it's very, very important information. And studio, we're heading down to the mall at 10:30 this morning to get the shots. Don't feel all you're running. Kid, we're especially coming for you and James. Ladies, thank you very much again.
Thank you for having us.
All right, so we do have this for you. It's a live traffic update from the Beatha Highway. What? Yeah. All right, a beautiful video there this morning, Madam Producer. Yeah. Where is that exactly? I'm seeing something. That could be at NP. Yeah? Around there? All right. Yeah. Yeah, we're taking let's take in a little more. All right. Yes. All right. It doesn't look too bad on the other side. That may be heading east. But the west, that is at just at where traffic branch is. Yeah? Not so, Jim? All right, thank you very much for that video this morning. We do appreciate it. All right, we're coming back, everybody.
Girl, you do something to me, that wine is too sweet. Look how I'm more than tantalized.